is Bermudez, and my presentation is on the role of barium sulfate in radiography. First, I would like to show you the Lewis structure of barium sulfate in order for you to see a clear image of what this compound looks like. This is a compound that has barium as the cation and the polyatomic ion sulfate as the anion. You're probably wondering, why is this substance inside of our body, or why is it placed there? Well, this substance is used as a medication to help examine internal organs as well as diagnose abnormalities, since if abnormalities are ignored or untreated, it can be detrimental to one's health. For this reason, I would like to start with the application of barium sulfate. It is used to coat the inside of various organs in order to obtain a clear image when a radiography exam, such as an X-ray or CT scan, is done. Most of the time, it examines organs in the gastrointestinal tract, such as the esophagus, stomach, or your bowels. This medication is seen as a contrast agent since it coats the organs and it leads to them being a bright white color, while the rest of the organs in that area are a darker shade of gray or black, meaning you're able to clearly see that organ being examined in the X-ray or the CT scan. This medication is given to patients through 4 different methods: a tablet, suspension, paste, and powder. Let's start with the tablet. It is the typical method of taking medication. You simply take it orally, and it, of course, has to be swallowed whole, since if the tablet is broken in any sort of way, it can affect the coating of the organ, meaning it could not coat dark enough, or it could just simply not coat a great majority of the organ. And then why would we want that? That could be very bad. Next is the suspension. It is in a liquid state, so it is taken orally or through an enema. An enema is when a doctor or a nurse administer a patient a medication renally. This is, of course, done only through suspension or the powder. Next is the paste. It is simply a substance that you take with any sort of liquid, such as water. Very simple. Lastly is the powder, which is just a fine grain that is mixed with water and taken orally, or it could also be taken as an enema. Next, I'd like to show you a little bit more about barium sulfate. It does not dissolve in water, and if it did, it would be highly toxic. Some consider it dangerous to humans because of the solubility that it has in the gastrointestinal tract. It has the typical side effects such as constipation or vomiting, for example. This medication, exams done with it are becoming less common due to an endoscopy, which is when a fine tube with a camera on the tip is pushed down your esophagus in order for the doctor to have a live view of your intestines. Lastly, this exam takes approximately 10 minutes. By that, I mean that by the time that you get to the place where your radiography exams are done, you should have already taken the medication a few hours beforehand, or a day beforehand, or it might be giving it to you as soon as you get there. Depends on how deeply it is being announced. If it would go to the small intestine, of course, it would need some time for it to digest. The only requirement with an examined medication is that the patient is required to not eat or drink a few hours beforehand in order for the organ to be able to be seen clearly, and it's not blocked by any sort of food or liquid. Next, I would like to answer the question of why I find this medication interesting. Of course, I find it interesting because it facilitates the job of a doctor, since it highlights the portions that are being examined. By highlighting, I mean that I think of this approach as out of the box, because you are technically highlighting your organs in order to see them clearly. Here I have an example of an X-ray done with this medication, and you're examining the esophagus. The esophagus here, you can clearly see the beginning to end, and even if the X-ray is taken in various points of view, such as the frontal or the side section, you're still clearly able to tell what is being examined. And I think that helps save time, and it also helps for the doctor to see clearly the measurements of that organ. For example, if it's a bit wider, if it's in the wrong shape, things of that sort. My next example, you're able to see more than one organ at the same time. For example, the bright white at the top right, that's the stomach. The one that's labeled number 1 is your small intestine, number 2, transverse column, and your 3, the descending column. Here you save time by taking an image of more than one organ at the same time, and you're able to rule out which organs are working and which are not. Lastly, and the main reason why I find it interesting is because I aspire to be a radiologist, and I think exams like these can help save time. And when it concerns your health, time is of the essence. You never know if, for example, a small pain can be just something small or it could be something big. Everything, there's a pro and there's a con. Next, I will be addressing the cons, which are the controversy with this medication. I mentioned 2 examples of the extreme that this medication can lead to. It can accumulate in the colon for 6 weeks or more for elderly patients or patients with colon problems. This is very frightening since the substance should not be in your body for that amount of time. Another example is that it can create phagocytes, which are hard masses of feces, and they obstruct the gastrointestinal tract and have to be removed surgically. For example, they can obstruct the appendix, causing it to burst, resulting in appendicitis. These are 2 very serious extremes, and I wanted to mention them since unreliable sources, such as blogs, add fuel to the flame by using examples such as these and stating that it can be an extreme risk to take a barium compound inside of your body, since barium is used. It's a metal, so it's used in, for example, the industrial field as weighing agents, and they think that it's very dangerous. To those people, I would like to say that at the end of the day, it's your body, and you should research what you're putting inside of it. To conclude my presentation, I would like to thank you for watching it, and here are my references in APA format.